Info for patient.
Do a please maneuver in every patient where the result,
No.
Like for example, in this
what I
case?
do is in patient, if they are subjectively positive, I give them exercises.
Right, exactly.
And if it is objectively positive, then I do appraisal.
Absolutely. So my
So
practice
that's my
is the
practice,
same.
yeah.
My practice is the same. If I see nystagmus, only then I do the maneuver.
Maneuver. Otherwise, in one case recently happened, they were so fed up, they said do the appraisal maneuver. So I did it and they were better.
Right.
But normally, the first advice would be go. And what exercise do you give?
Well, you have brand of exercises,
I keep it very simple. Just the same thing. Just tell them to turn the right and just like help right. Just go down for 1 minute and 5 times, 3 times. 5 times, 1, 2, 3 and 3 times a day.
Usme na exercise almost, I think many of the exercises that are available, they work.
Yeah,
almost
the
all of them.
idea is to induce vertigo. Why do we advise exercise? I explain to the patient, if you're sitting in a room and if you switch on off the lights, and initially it will be unpleasant, but after a few hours you get used to it. So the reason we do the exercise is for the brain accommodation. So we're trying to induce vertigo in the patient so that the brain accommodates. وہ برین کے یار یہ تو روٹین ہے جان دو.
جو خورشید صاحب بات کر رہے ہیں نا وہ ایگزیکٹلی آئی آلسو ایگزیکٹلی the same exercise. The patient sits on his own bed. He would sit on his own bed and then lie down in the Dix-Volpec position. And when the dizziness disappears, he comes back and then turns the head to the other side and goes back. Okay? And naturally the other side, perhaps the patient will not experience dizziness. Wait for about 5 seconds, then get up in the same position, turn the head to the other side and then go back. Keep repeating until the dizziness disappears. It takes about 7, 8 times, 10 times.
اور میں مریض کو کہتا ہوں آپ کو 2 فائدے ہوں گے. آپ کا چکر بھی بہتر ہو جائے گا, آپ کا پیٹ بھی اندر ہو جائے گا.
I think so یہ exercise available ہے YouTube پہ. YouTube پہ available ہے.
Available ہے لیکن
میں نے ایک اپنی بنائی ہوئی ہے.
difficult to explain to the patient. Most of the patients are not that educated. So you have to keep things very simple. That's for my own.
جو دوسری ایک اور ایکسرسائز ہے which also works very well, that you sit on the side of the couch. یہاں پر آپ بیٹھ جاتے ہیں اس کے اوپر. And then, for example, if this was a right-sided dizziness, then you lie down on your